Hello, everyone. Welcome to episode 1 of #IGD Talks. My name is Raquel Simpson, and I will be your host for today. Just to introduce myself, I am a practical nursing student, and I hold a master's degree in emergency management. I recently embarked upon this wonderful journey of gerontological nursing. I will be introducing a number of special guests who will be providing invaluable insight in dementia care, dementia research, training, and education. Let's get started. Enjoy the show. I'm super excited for the guest that we have today. So I'd like to introduce Patricia Julian. So welcome. Thank you so much for being a part of our episode. We were super excited for just this conversation and to have this dialogue with you.
Thank you. It's a pleasure to be here.
Awesome. Yeah. So why don't you just tell me a bit about yourself and your interest in gerontological nursing and how that all came about?
So I'm currently a registered nurse at cardiac and vascular surgery. Before that, I work in general medicine and acute care. I first got interested into nursing several years ago when I was a volunteer in a long-term care home. Before I was a volunteer, I had misconceptions about people with dementia.
Sure.
I found them intimidating because I heard about these behaviors, about, like yelling, kicking, hitting. But then I volunteered there, and then I saw like how the nursing staff and the other healthcare professionals, how they manage these behaviors and even reduced or prevented them just by engaging them through activities that they loved, like reading, music, and just by using communication techniques. And I was so impressed by what I saw that I was inspired to become a nurse.
That's awesome.
Yeah, that's why I'm here today.
That's awesome. Thanks for sharing that. Wow, just the power of seeing someone kind of navigate through some difficult circumstances in healthcare can really impact, I think, students greatly and those who are training up to become healthcare professionals.
That's right.
Yeah, that was a perfect example. Thank you for that.
You're welcome.
So let's talk a little bit about this research project that I hear you were a study team member of. So just to understand specifically what was taking place here, there were 100 students who participated in this project, correct?
That's correct.
Okay, who came from various disciplines, including, for example, nursing, medicine, occupational therapy, physiotherapy, just to name a few. Students were expected to participate in an e-learning course, which consisted of 4 modules on gentle persuasive techniques.
That's right.
And the second half of the project involved students coming to a workshop. It was a skills workshop specifically. Is that correct?
That's correct.
Okay. Can you tell me a little bit more about this project and your role in that?
So like you said, phase 1 involved an e-learning module of gentle persuasive approaches, or GPA. So in the phase, students took like the survey before they completed the module, and they did the same survey after to see any differences. The differences look at their confidence in working with people with dementia and their self-efficacy when working with these individuals. So a lot of the self-efficacy is based on Albert Bandura's theory of self-efficacy. Right. And the second phase is, like you said, the face-to-face workshop. So it involved the GPA module and also the skills day, the geriatric skills day, which involved sessions on like the Montessori methods, the prescribing. And as a team member, I helped organize the day. I helped get some speakers, collected some surveys. I've also been involved prior to this in evaluating the GPA e-learning module when I was a student at Ryerson University.
Great. Yeah. Now, I do understand that specifically in this workshop, there was discussion on, and the emphasis was on non-pharmacological interventions.
That's right.
Can you elaborate a little bit more on this and why it is important?
So we try to reduce the use of antipsychotics as much as possible in managing behaviors, because they can actually worsen the behaviors, or they may have negative side effects. So we discuss like techniques such as communication or engaging the residents in activities that they like. We also talk a lot about deprescribing, look at this medication. Like, does the person with dementia actually need this medication? Right. And that's what they've talked about it as well.
Okay. And just for our listeners, can you maybe elaborate on specific examples of non-pharmacological interventions?
Okay. So let me just look at examples from my clinical practice.
For sure.
So let's say I have somebody with dementia, and this person is calling out and yelling in a foreign language. And then if we don't know too much, the first action might be try to stop this behavior by using an antipsychotic. But then if you try to learn more about the person, maybe about their past, or maybe let's say this person doesn't know English, and then you learn that in their language just means like water. So what I can just do is just give them water and it's done.
Right.
Because responsive behaviors are often like signs of unmet needs. It can be thirst, the need to toilet, the need for companionship.
Absolutely.
So as long as you address that trigger,
right,
then you wouldn't need to use any antipsychotics.
Awesome.
Yeah.
Awesome. Thank you for explaining and expounding on that.
Yes.
Can you tell us why you think this type of learning is... So getting back to the specific research study, can you kind of explain why you think this type of learning is important for healthcare students, knowing how to interact with patients who have dementia, learning to assist with responsive behaviors, learning to some of these techniques? Why is that important?
So it's also really important because of the growing aging populations and the increasing incidence of the responsive behaviors in healthcare. I work in general medicine and in cardiac and vascular surgery, and I've been noticing that there's more increasing incidences of responsive behaviors, and then some studies shows that it can be up to 10 to 50% in various healthcare settings. So it's important that we prepare the healthcare professionals to manage or to mitigate the behaviors. And these behaviors can lead to stress, not just on the staff, but also can cause injury in the patients or clients as well. So if we know how to manage these behaviors, we can reduce negative outcomes. Second, it's important to have this education as well, because some people might not be interested in gerontological nursing or geriatrics, and educating them about all the possibilities and the rewards that you can get from working with people with dementia and older people can actually inspire a lot of intelligent future young professionals to enter the field.
Absolutely.
Yeah.
That's fabulous. That's great. What are some of the key points or takeaways that you found specifically in the workshop component of this research project?
So one key takeaway that I remember that I've also enact in my current practice is documentation. So when you encounter responsive behavior in healthcare, one common practice is to describe the person as agitated. Okay. But what does agitated mean? So when you look at some of this documentation, you're thinking, what is agitated? It can mean anything. And how can this agitation be addressed? So I learned that it's better to describe using specific non-judgmental descriptors, such as maybe yelling, kicking, calling out the specific words, calling out toilet, calling out the name of somebody. And that's better because that allows the team to go over the documented lists of behaviors and brainstorm a proper method on how to address them. And also in my documentation, I also include, for example, methods or solutions that I work with this client. Maybe, for example, I've given someone water, I've used a phrase from their language, and if that works, I document it. Right. And that ensures that gets passed on to other team members so that we can have a consistent approach to this client's behavior. Okay. And another key takeaway is that I remember from the workshop is empathy. So as a nurse, as a recent graduate from last year, I can still be very task-oriented. So it's easy to feel frustrated with a person with dementia or exhibiting behaviors because you feel like, I don't have time for this. I need to get this task done. But then you remember, you put yourselves in their shoes and you think, how would I feel if somebody was forcing me to do this task? Right. So you learn to back away and think, is this task really a priority? And you learn how to work with a person, work with their choice in order to, of course, maintain the best healthcare for them.
Right. Could you give maybe a specific example of maybe what that might look like in terms of, you mentioned the keyword that you said was working by giving a choice to this person. What would that kind of look like?
So it can be something like, let's say there's somebody who needs to have a shower today. So working by giving a choice, you come there and you explain to them you're gonna get a shower. You give them detailed descriptions of what's going to happen. So you don't just start giving them a shower. And then and then the choices, they can come in small things, like, can I help you take your shirt off? Or it can just start as, do you want a shower now? They say no, well, that's fine.
Right.
They're not gonna die if they don't have a shower. Right? Yeah, something like that. Yeah. It depends, and it comes in medications too. So let's say you know that this person likes their meds with pudding. So you crush it and you give it in pudding.
Right.
Right? So that's their choice. They want it in pudding because, yes.
So you're accommodating.
You're accommodating with them. Or if they don't want it now, they want it later. And you just think, do they have to get this med at this specific time now? You can just come back.
Right.
Later, right?
Right.
Mm-hmm.
Interesting.
It's really complex. It involves a lot of priority setting as well.
For sure.
Yes.
For sure. So what other ways has your participation in this study influenced you as a practicing nurse?
Yes, so I've talked about documentation. I've also talked about working with a person's history, their personality. Other ways, I've also learned how to communicate in such a way that's tailored to the client. So let's say I work with clients who don't know English. Okay. I try to learn some phrases from their language, such as maybe water, toileting, food, just to give them a sense of familiarity.
For sure.
Yes, and another way is also with delirium, preventing delirium. So delirium can happen with people with dementia, and can also happen to people without dementia. So with that, I try not to give meds that might cause delirium.
Okay.
Yes, so one med, for example, is Gravol. Gravol actually can increase delirium in the elderly. Okay. So I try to give, like, if you're getting nauseous, I try to give something that's less likely to cause delirium, like Zofran.
Okay.
Yes. Or if not, we try to suggest that.
Right.
Yeah, to the healthcare team to give something else.
Right.
Right, yeah.
Okay. Is there anything else that you would like to tell our audience about GPA or the focus of GSDW on BPSD?
Well, I'd like to say that if anybody is listening who hasn't considered a career in geriatrics or in gerontological nursing or in that field in general, I would like them to maybe ask them to just consider it, or just try the workshop out, because even if they don't join that field, it's highly likely that they may encounter an older person in their practice, unless they're maybe in maternity or pediatrics.
Absolutely.
Right?
Absolutely.
I think it's a good way. But even if you're in that field, in your daily life, maybe your neighbor, your family member,
absolutely,
it would be, I think this knowledge is very useful for any person.
For sure.
Yes.
Awesome. That's great. So thank you so much for taking the time today, Patricia. To our audience, please tune in to our follow-up podcast in this series. Oh, I also want to add this, you made mention to the GPA manual.
That's right.
And the 4 modules. So this is actually the 3rd edition GPA basic manual. And this is something that we would highly recommend if anybody is interested in dementia care, curious about dementia care, currently working in dementia care. This is absolutely a resource that can equip you and enable you to feel more prepared and more ready to work with older adults who may be living with dementia.